I'm Cassidy.
I'm Sawyer.
I'm Tobin.
I'm Peyton.
I'm Jensen.
And I'm Ruby.
We're going to tell you a bit about the digestive system, the functions, and diseases that occur within the system.
Hey Sawyer, have you heard the joke about the small intestine?
No.
It was Villi funny. On a more serious note, there are three main functions of the digestive system: digestion, absorption, and elimination. These functions are integral to the production of energy in the body through cellular respiration. Without digestion, nutrients cannot be broken down and absorbed into the bloodstream. If nutrients are not absorbed into the blood, cells will be unable to create the energy necessary for life. Elimination is also an important function responsible for the removal of waste products and other substances that are unable to be digested.
Paying attention to your diet will help the digestive system remain healthy. High fiber diets, limiting foods that are high in fat, choosing lean meats, staying hydrated, eating on schedule, avoiding bad habits such as smoking, and not having excessive intake of caffeine and alcohol, and managing stress. Exercise is important in maintaining regular bowels. Pay attention to how you feel after eating certain foods. Eat foods with probiotics, which are supplements containing bacteria that have been shown to be helpful for intestinal health.
Maintaining a healthy stomach and well-functioning intestines is something we do every day by making good choices. It is easy to be in a rush, make the wrong choices, and deal with the consequences later. But if you want to get into the habit of doing what is good for your gut, then your gut can help take care of you.
I can't remember the name of the enzyme that breaks down carbohydrates. It's right on the tip of my tongue.
Like all body systems, the digestive system is susceptible to disease and malfunctions that cause the body to deviate from homeostasis. Foreign pathogens, poor health choices, and abnormal immune responses can cause the digestive system to become unhealthy. Examples of such ailments include appendicitis, hemorrhoids, celiac disease, cirrhosis, and Crohn's disease.
One such disorder of the digestive system is the inflammation of the appendix due to the blockage in the opening of the appendix caused by stool, cancer, or infection. This disease is called appendicitis. If untreated, the appendix will burst, spilling infectious materials into the abdominal cavity. Symptoms of this disease include abdominal pain, nausea, vomiting, fever, severe cramps, and loss of appetite. This disease is most common in people aging 10 to 19 and 1 in 430 people annually. Although this disease doesn't have a specific prevention, it is said that those who eat high-fiber diets are less likely to have appendicitis. Fortunately, complete recovery is possible through surgically removing the appendix.
Hemorrhoidal disease is when hemorrhoid tissue in the anal canal protrudes. It can cause pain and bleeding and cause veins to stretch under pressure, which will lead to bulging and swelling of the anus. Hemorrhoidal disease is caused by complications of constipation, straining during a bowel movement, and a long family history of having hemorrhoids. Signs and symptoms of hemorrhoidal disease includes pain, swelling, and irritation, and sometimes excess skins, or called skin tags. Straining causes the hemorrhoid surface to bleed occasionally, and hemorrhoids can be treated with home remedies such as a high fiber diet, or over-the-counter creams and ointments, and minimally invasive surgeries. This overall obstructs the elimination process.
Celiac disease is a digestive autoimmune disorder in which one cannot digest gluten out of ingested food. It can be difficult to diagnose due to the similarity of symptoms amongst other digestive disorders, such as irritable bowel syndrome and lactose intolerance. Gastroenterologists may diagnose celiac disease with a medical or genetic history, a physical exam, blood test, genetic test, or a biopsy. Symptoms vary from person to person, but include bloating, chronic diarrhea, nausea, constipation, and stomach pain. 10% of those diagnosed with celiac disease suffer from dermatitis herpetiformis, an itchy, blistering skin rash. The only known treatment with 100% satisfaction is maintaining a gluten-free diet. Failure to do so leads to small intestine damage, specifically into the villi.
Hey, are you on a non-gluten diet?
Yeah, dude, it gets my muscles roasted.
Well, actually, gluten's good for you unless you have celiac disease.
Oh, time to go load up some bread and hit the gym.
More carbs, more gains.
Over 25 million Americans have gallstones, and 3 million plus cases are reported every year. However, only 1 to 3% of people with gallstones report to have any symptoms. 50% of women in the U.S. will have had gallstones by the age of 75. The gallbladder is the most affected organ by gallstones. Gallstones are caused by the gallbladder not emptying correctly, causing crystallized bile to build up. The indigestion of high amounts of fat and cholesterol can cause bile to be overproduced, resulting in the buildup of bile in the bile ducts. Symptoms include severe pain, nausea, indigestion, cramping, and vomiting. Gallstones can be diagnosed by an abdominal ultrasound, special dye images, and blood tests. Treatments include a low-fat diet, cholesterol medications, and laparoscopic surgery. Long-term effects include loss of gallbladder and diarrhea until the body adapts to the loss of the gallbladder.
Cirrhosis is a chronic liver disease caused by a variety of symptoms leading to scarring and failure. It turns out that cirrhosis leads to the formation of fibrous scar tissue, which blocks the flow of blood. The fibrous scar tissue is also known as regenerative nodules, which are circles of fibrous tissue that form in the liver. The age groups mainly affected are from the ages of 45 to 60 and are mainly women. It turns out that when you get liver cirrhosis, you suffer from mild symptoms, but as the disease progresses, the symptoms become worse. Unfortunately, there is no treatment for cirrhosis, and the only thing you may do is get a liver transplant. Warning, if you do not get a transplant, you will die.
Crohn's disease is an inflammatory bowel disease characterized by inflammation that may affect any part of the gastrointestinal tract, but is most commonly found in the ileum of the small intestine. In this instance, Crohn's disease disrupts digestion by causing inflammation that narrows the small intestine to the point where the flow of contents through it to the colon ceases. When the small intestine is obstructed in this way, food, fluid, and gas cannot pass into the colon, resulting in a number of symptoms that vary depending on the severity, including abdominal pain and swelling, vomiting, a high fever, and anemia. As a result of the uncertainty surrounding the cause of Crohn's disease, there is consequently no cure or method of preventing it. Fortunately, however, there are a wide range of treatment options available to help the patient achieve and maintain a state of few or no symptoms known as remission.
The digestive system plays a very important role in maintaining homeostasis through absorbing needed nutrients for cellular respiration and eliminating unwanted waste from the body. Maintaining a healthy diet and making good lifestyle choices can prevent these disorders and keep your body functioning properly.